decided it didn't want me to. Interesting. My apologies. We had it all set up and then it decided it didn't like our setup anymore, I guess.
You're good.
Yes, no worries.
Take your
All
time.
right. Now it's looking like it's hopefully going through here. Gave me the go live option, so.
Yeah, I see the comment there. Now streaming live on Facebook.
All right, perfect. All right. So, thank you so much for joining me today. My name is Erin Look. I work at the Auburn Hills Public Library. I've been the Youth Services Coordinator here for about 2 years. And I am joined today by our two guests who we are so grateful for their time this evening to chat with us a little bit about some public health tips as we move forward into the fall and winter. So our first guest today is Stephanie Swanberg. And forgive me, I haven't done a program in a while, so I'm going to read off my sheet here. Stephanie is an associate professor, information literacy and e-learning librarian at Oakland University, William Beaumont School of Medicine Library. She has been at OUWB for 9.5 years, since right before the first classes started, which I didn't even know. And she has a passion for teaching her students and for planning community outreach. This passion has greatly benefited both the medical students at the library and the library. She spearheaded a partnership with the library offering health information as part of our elementary age programming, which was very successful. And she also wrote and was awarded a health information outreach grant, which benefited the library because we were able to start circulating some health literacy kits and receive additional funding for that programming that I mentioned. And most recently, she has made tonight's program possible. So thank you, Stephanie. And then our guest of honor tonight is Dr. Ida Rubino. She is a family medicine physician with Beaumont Hospital in Troy and received her MD degree from Wayne State University. She has been a practicing physician in the Metro Detroit area for over 25 years. She is also an assistant professor at the Department of Family Medicine at the OUWB School of Medicine and currently serves as the course director for the first year Art and Practice of Medicine course, which teaches medical students the basics of doctoring, including communication with patients and the basics of taking a patient's history and conducting a physical wellness exam. Thank you so much again for your time. I think if it's okay with both of you, I just would want to get started jumping right into the questions. We only have 30 minutes here today. So I was just going to start off with the first question that I had written down and one that's definitely been on my mind. Now that we are entering cold and flu season, what do you recommend families do if their child starts to exhibit symptoms of an illness?
Thank you, Erin. So, yes, I think it's important to remember that not everything is COVID. And so we still do have the old fashioned cold, and we also see influenza, although we're not seeing much of it just yet. So, anytime your child displays any symptoms of illness, so a runny nose, a cough, a fever, congestion, fatigue, headache, etc., um, it's important perhaps to consult your pediatrician or family physician's office, maybe speak to the nurse at the office to get some guidance as to whether your child should be seen or if it's something that can be treated at home with supportive care. And don't panic. Again, not everything is COVID. So there's many things about the common cold or even influenza that are different from COVID-19. So the common cold, you may have a fever, but it won't be a high fever, and you may not even see a fever. Your child may simply exhibit some respiratory symptoms such as a clear runny nose, maybe a dry cough, maybe some mild aches and pains. Influenza is a little bit different, and people do get a little bit sicker with influenza, and the classic symptoms are cough, fever, and body aches. And COVID 19, really, you can see a whole variety of symptoms. It depends on the person. But in children and adolescents, the most common symptoms will be cough and fever. Although a lot of the adolescents we're seeing are developing maybe a headache and fatigue, and the symptoms are not typically lasting as long. So they may not be sick for the full 10 to 14 days. So if your child has a fever or illness, mild illness symptoms, keep them home. A lot of the schools are set up for hybrid learning or online learning, but if they're face to face and they display any signs of illness, I would recommend keeping them home, both so they can improve and feel better, and also so you don't infect the other students. And kids are typically open to a day of movies and fluids and rest and that kind of thing. And that's what we refer to as supportive care, where you simply treat the symptoms and let the body's own immune system start to fight it off. And that's typically through rest and fluids.
So would you recommend that they reach out to their family physician once their child starts to experience just even not COVID symptoms, especially this year?
Absolutely. And they may not always need to be seen. In our office, for example, we have full time nurses on staff who simply help triage calls most of the day. And so they can, and I'm sure there's a lot of worried parents this year because of COVID 19 and everything we're hearing on the media. But again, not everything's COVID. So if you just need to talk through it, a lot of pediatric offices also have nurses triaging calls. So go ahead and call, talk through it, and more than likely you'll be advised to simply stay at home and offer that supportive care. Even after hours, there's ways to triage those calls. The nice one of the silver linings of COVID is that telemedicine really has become kind of a new normal. And for some mild illness, we are offering telemedicine visits, which is nice. So you wouldn't have to drag your kid out of the house if you simply needed to talk through it. And if it's not something that needs to be evaluated in the office, then perhaps we can offer medical advice that way. Now, sometimes with the younger kids, it is tricky because simple cold symptoms may also be part of maybe an ear infection, something that's painful or that would require an antibiotic. So be aware, not all offices are open to seeing respiratory things this year. Sometimes they will refer you to an urgent care. So be aware of what your pediatric or family medicine office is offering right now.
Thank you. That was very comprehensive. I wanted to ask as well, sort of along with this question, did you have any recommendations about where or when to get the flu shot this year? Because I know
Yes.
we've been hearing that it's very important to get this year like every year.
Yes, yes, yes. And I think Stephanie agrees. I've had my flu shot, my kids have had theirs. So it's always important to get the flu shot. Healthy kids get the flu every year. And unfortunately, healthy kids die from the flu every year. It's not common, but it does happen. Even here in Michigan, we see it. And so I really believe that vaccines are one of the best, if not the best, forms of prevention that we have. We have a very safe influenza vaccine. The shot or the inactivated form of the vaccine does not contain any live virus. So it's impossible to get the flu from the vaccine. Although people may tell you, I felt sick after the flu shot. Now, to maybe feel a little flu like for a day, it could simply be their body's immune response to the vaccine, really starting to mount those not get influenza from the flu vaccine. The vaccine takes about 2 weeks to be fully effective. So perhaps someone has been exposed to some type of illness that time or maybe in the weeks prior, and they're just starting to manifest symptoms as a result of that exposure. But you will not get sick from the vaccine itself. So it does not contain live virus. It is very safe. Is it 100% effective? No, because we base the vaccine typically on 3 or 4 strains from last year's flu season, and that's how we make the vaccine each year. It's not 100% effective, but it's the best that we can do each year, so it is very effective. So even if you were to get influenza shot, typically it would be less severe. So we've been offering the flu vaccine really since September. You can get it anytime now. And I would encourage parents to get their kids vaccinated against influenza if their child is 6 months or older. There's a live form of the vaccine, which is the nasal spray. It's a squirt in the nose, so there's no needles. Also very effective, but there are some precautions with that one. So if your child has Certain medical conditions, you would want to speak to your primary care doctor about whether they're eligible for that vaccine. But typically, the inactivated or the shot form of the vaccine, there's very few precautions. If you've had a true allergic reaction to the flu vaccine in the past, if you've had certain medical conditions following a vaccine, such as Guillain-Barré, which is very rare, if you have a severe egg allergy, such as swelling and trouble breathing, you actually can still get the flu vaccine, but you'd want to do it under a supervised condition, perhaps in an allergist office or in your primary care doctor's office if they're trained to treat reactions. So the bottom line is overall, the flu vaccine is very safe. It's available, whether you go to your doctor's office, the pharmacy, or even the health department, and you can get it done right now, which will help protect you when flu season starts to ramp up.
Thank you. All right, before we move on to our next question, I see that Stephanie, like a good librarian, has shared a couple of resources in the chat. Stephanie, do you want to take a moment to talk about those resources?
Yes, so I was totally jumping off of Dr. Rubino's conversation and answers. So I had a couple of resources that I would recommend as a librarian. Kidshealth.org is a really wonderful resource from the Nemers Foundation, which is a nonprofit. And they actually have a summary page that specifically is about, is it cold, the flu, or COVID 19? And so it nicely summarizes exactly what Dr. Rubino was saying, but in a nice, clear, clean format that you can just revisit over and over. So we can share these out after the fact for the recording. The second one is there are so many resources out there about the myths and facts associated with the flu and flu vaccine. I pulled one from Harvard Medical School. It's just kind of fun. 10 flu and flu vaccine myths debunked. So you can test your skills and see how much you know about the myths and facts about the flu vaccine.
Thank you for sharing those. So if you're either watching live or you're watching after this has been live, I will put out a post on the library social media sharing out the resources that Stephanie shares with us. She also took the time to share a handout with me before the meeting, so that I will be posting that out as well. All right, so our next question actually kind of leads perfectly with this segue. And Stephanie, I will address this question to you as well. Can either of you recommend any resources or ideas for teaching children about the spread of germs and just generally being safe out in the world as it looks right now?
Stephanie is a wealth of resources, but I'll do my best and then I'll pass the torch. I usually will and patients to scientifically based, reputable sites rather than just searching, especially things like vaccines. So I think the AAP, the American Academy of Pediatrics, does a wonderful job with patient and parent education, and there are some excellent resources there. Similarly, the AAFP, American Academy of Family Physicians, has quite a bit on patient education. I also think the CDC is a great resource. You can click on the healthcare provider or patients, and so there's different language and different education posted on their site as well. I don't really know about any animated sites or anything for younger children, but the AAP may have some links that could be helpful. Stephanie, anything to add?
So I'll just echo you, Dr. EC, and I'll post it in the chat. There's actually an entire page dedicated to how to talk to kids about COVID, and it actually gives tips and tricks both for parents, for school teachers, for anyone that may be working with kids and just need to describe in their own words and things that they can understand what is COVID and what can we do to protect ourselves. And the CDC has really worked hard to create these types of pre-made things for people to be able to look at. So there is an entire section dedicated to how to talk with kids, how to help them cope through these difficult times. We're all like under stress, and it's a very, very difficult time, and lack of socialization is hard. So there is a lot of rich information in the CDC. In terms of things at kids levels, like in terms of fun things, Nemers actually also does a really good job of this on kidshealth.org. They provide videos and animations sometimes to describe some of these things. So if I were going to look somewhere first, I would recommend that and then go from there and see what's available.
Thank you so much for that great answer. I know a lot of parents are looking for different resources to, just address this with their kids, especially as, again, we're moving along into our next question. We start thinking about going back to school. So I know here in Auburn Hills, the public school system has not reopened yet. Some private school, or for in-person learning, I should say, they are doing virtual learning. Some of the private schools in the area have gone back to in-person. So as the schools start to think about transitioning back to in-person learning, do you have any advice that families should keep in mind as they prepare for that change?
Sure. I mean, well, we know that the personal protective equipment works. So we know that masks work. And I am amazed at how compliant kids can be, even at a young age. I see it with my nieces and nephews, and they keep their mask on. So, and I really am impressed with the schools that have opened, a lot of the maybe private schools or smaller schools that have opened from day one, how they've really expanded their space and distanced the kids, and they're wiping down the surfaces after each class. They're taking time for fresh air where they can get the kids outside and take their mask off. They're trying to ventilate the building. So I think with the proper measures and the proper education at home, I think it can be very successful. I've also seen the administration be very cautious if they do have a positive case or more than one positive case. They are encouraging or requiring quarantine for any of the direct contacts. So any of the kids who sit next to the person who tests positive, they're sending them home for a couple weeks. And already having that hybrid learning in place has been very helpful. So I think it's the same precautions that we've been taking, and I agree. I think you have to weigh, like anything in medicine, the risks and benefits, and sometimes the lack of socialization might be worse for the kids, or the lack of routine and structure, or access to meals. I mean, there's so many things that the kids might be lacking by not actually being in the building. I've seen a lot of districts successfully kind of gradually reintroduce the students to the building, whether they continue a hybrid approach or half days. But I know for even for the kindergartners who are online 6 hours a day, it's probably worse than some of the other things that we're worried about. So I like that we're moving forward in this direction. You know, kids who have high risk medical conditions, we may need to take different precautions. And it's similar to adults. So things like maybe severe asthma or congenital heart disease or any immune compromised condition, we may need to take additional precautions or at least have the option for parents to maybe stay at home and use that virtual online learning for a while.
All right, I want to keep us moving along because we already only have about 10 minutes left. This time is going very fast. I'm enjoying our conversation. So my next question is along the same lines. You uh, may have a similar answer, but I just wanted to ask. I know something on our mind here at the library is that the holidays are coming up. They're right around the corner with Halloween, Thanksgiving, Christmas. So I wanted to ask if you just had any general advice about traveling during this time, or any other thoughts you wanted to share.
Yeah, and this is a conversation I've been having with my own family. So that's a tricky one. And again, I think we need to use common sense because sometimes not being together may be worse. But at the same time, we all know if we've had the news on even for 5 minutes that the virus is spread by respiratory droplets. It's most likely spread by airborne, which can be smaller droplets. And so when you're closed indoors and you're in a closer space and you're not as distant and there's not as much air ventilation, it's more likely to spread. And so if someone is unaware that they are positive and there's somebody in the home who's higher risk, I do think you need to think that through. You know, in Michigan, we really can't have an outdoor gathering. So if there's elderly patients or family members or individuals with high risk health conditions that puts them at more risk, then we may need to look at alternative approaches. You know, people talk about their bubble of people. So if there's already a group of people that you regularly are in contact with, and those are the same people that you'll be with for the holidays, then maybe that's an option. But if you have family members who might have to travel through an airport and are unable to drive, and then they need to come together with maybe some grandparents who have lung conditions or diabetes or other health conditions, I think you need to have some serious conversations about the risk there. Again, risk benefit.
Right. Thank you for that answer. Like I said, I know it's on a lot of our minds, so I appreciate your candor with it. Stephanie, I saw you shared another resource, two more resources in the chat. If you wanted to take a quick second to address those.
No, I'm kind of working backwards. I was going to Dr. Rubino's recommendation of going to the AAP, and they host, of course, healthychildren.org, which is information for parents on all like of the lifestyle of all the developmental milestones and common diseases and conditions. They also have COVID information, so that's a great resource. And then the CDC, of course, is constantly updating their recommendations based on the latest research and the latest findings. And so they do have currently information available for the upcoming holidays in terms of recommended activities for Halloween, Dia de los Muertos, and Thanksgiving. I'm sure come the winter holidays, we'll also be seeing recommendations for that. So that's just another thing to keep a lookout for.
There it is.
Right there.
We have a whole page on holiday celebrations.
I'll be carving my pumpkin.
Right. So finding alternative ways to have fun, and carving pumpkins is one of them.
That's an awesome idea. I love that. All right, so we are on to the last question that I had prepared today, which is shifting away from COVID-19 a little bit, which I know all of us could use a little bit of. So I just wanted to ask if you had any general health advice you wanted to share, just for the families out there that are watching.
Oh, sure. So I know the focus for today is on pediatric care. So
Mhm.
for children and adolescents, please make you're getting your kids in for their well child visits, their physicals, and their immunizations. Because we have found that even with adults, everybody is behind because we all sheltered at home for so long. And then there was that hesitation to return back to the hospital and the doctor's offices. So, more than ever, it's critical to make sure the term we use is health maintenance. Make sure you're taking care of your wellness and especially immunizations for children and adolescents. That's critical. And the ACIP, which the CDC is affiliated with the ACIP, that's a group of people, vaccine experts who get together several times a year and make recommendations on the vaccine schedule. And they have a very good catch-up schedule that we can follow. So we can actually kind of shorten the intervals between vaccine doses to catch kids up if they missed a dose. And it's very safe and very effective. So that would be my biggest message, in addition to getting your flu vaccine.
Yeah, that's a great message. That's something that I wouldn't have thought of. That with shelter in place, more people may have fallen behind on their annual visits, and especially normally that's a back to school time to get in and get your physical before heading back to school. And with that being a little different this year, may have not have come into people's minds. So that's a very good advice. Thank you. All right, that was my last question that I had for today. I haven't seen any questions come through on the chat, although my Facebook looks a little strange, so hopefully I haven't missed anything there. If we get anything later, I will send it along to Stephanie and see if it's something that she can address. But before we end our stream here, Stephanie, did you have anything that you wanted to wrap up with?
I will just put one last plug in for a fantastic free online resource that, as a medical librarian, if anyone ever asks me where do you go to look for health information, I always recommend Medline Plus. It is much less well known than WebMD, but so much better. There's no ads, there's no things trying to diagnose what you have. It is just plain health information on anything you can think of. So whether it's for your children, or your adolescents, or for yourself or another family member, just go on that website. Again, we'll provide that in links and resources after the fact. But that's kind of a catch-all. That way you don't have to think about all the resources that you think, what did we talk about today? If you remember one thing, go to medlineplus.gov. It is fantastic, and it will link you out to all these other resources that we've been talking about in one way or another. I have.
Thank you.
I agree. That's an excellent point, and it's so important to go to reputable sources, because you can just about search anything these days and it's not always good information. So I think that's an excellent point.
Absolutely. We definitely will we'll make sure at the library that we get Medline Plus. If we don't have it up on our website, we'll make sure we add that in. We have a parent resource page up on our website. It addresses more of the social emotional resources that are available to parents right now, but we're always happy to add in additional resources for parents. And also, as a quick note at the end, if you weren't aware, the library, the Auburn Hills Public Library, is open for grab and go service. So you are able to put items on hold. You are able to come in and check out books. Unfortunately, that's really all that we're offering right now, just book checkout. But we have some good resources, and we are working on building up our health literacy collection for parents and just anyone who's interested. So make sure you check out our website as well. All right, I think that's everything for today. Thank you, Dr. Rubino and Stephanie, for your time. I really appreciate this. This was such a helpful, hopefully helpful to our parents, and certainly helpful to me to hear a little bit about what's going on in the medical community and what families can be thinking about this fall. So thank you again for your time.
Thank you, Erin. It was fun.
Us today.
I'm going to go ahead. All right, I've got our streams ended here. So there we go. Thank you